Hey, welcome to The Explainer. Today, we're going to pull back the curtain on a physical exam maneuver that's been around for more than 100 years. But you know, in our high-tech world, its power is so often overlooked. We're talking about the hepatojugular reflux, a really simple bedside clue that has this incredible ability to tell us exactly what's going on inside the heart.
So, to really get why this matters, let's just start with a number, 25 million. That's the staggering number of people around the globe affected by congestive heart failure. I mean, it is a massive global health crisis. And in the fight against it, every single tool we have, especially one this simple and accessible, is just absolutely crucial.
All right, so here's our game plan. We're going to kick things off with the history of this kinda forgotten clue, and then we'll break down the science behind it with a really easy-to-understand analogy. After that, we'll walk through how you actually do the test, what a positive result really means, and finally, why this one little sign can be such a powerful predictor of future trouble. Okay, let's get into it.
Okay, first up, rediscovering a classic. You know, in an age filled with MRIs and all sorts of complex diagnostics, some of the most powerful tools are still the simplest ones, the ones that just rely on a good, skilled physical exam. And the hepatojugular reflux, it's the perfect example of this.
The story here starts way back in 1885. That's when Pasteur first described this sign. And for decades, it was just a cornerstone of the physical exam. It was standard stuff. But then, in the late 20th century, with the rise of all this non-invasive imaging, the value of these hands-on skills, well, it started to come into question.
So what exactly is it? It's actually pretty straightforward. The hepatojugular reflux, or HJR for short, is what we see when we apply firm, steady pressure to a patient's belly, and in response, their neck veins bulge out, and they stay that way. The really critical point here is that this simple visual cue is a direct window into the pressures inside the heart. Now let's dig into the science. To really understand why this happens, I want you to think of the heart as, like, the center of a major traffic system. And what we're about to do is create a little traffic jam on purpose to see how the system handles it.
So when we press on the abdomen, we're basically pushing extra blood, our traffic, back towards the heart. Now in a healthy heart, the right ventricle just easily handles this extra volume. No problem. The neck veins might bulge for a split second, but then they go right back to normal. But in a failing heart, the right ventricle just can't keep up. It can't handle that extra flow, so the blood backs up into the veins, and that's what creates that sustained, visible bulge in the neck. It's a classic traffic jam.
And this is what makes it such a brilliant diagnostic tool. See, a positive HJR isn't a sign of just one single thing. It tells us that the right ventricle is struggling to handle more blood coming back to it. Now, that could be because of right ventricular failure itself, or maybe something like constrictive pericarditis, where the heart is literally being squeezed by a stiff outer layer. It could be restrictive cardiopathy, where the heart muscle is too stiff, or it could even be high pressures backing up all the way from the left side of the heart. It's a fantastic clue that points us in the right direction.
So, how is this thing actually done? Well, you might be surprised at just how simple this really powerful maneuver is. It's just a quick, three-step process you can do right there at the bedside.
First, you got to get the patient in the right position, usually tilted back at a 30 to 45-degree angle so you can get a really clear view of those jugular veins. Second, you apply firm, steady pressure to the abdomen. And third, you just watch those neck veins for at least 10 seconds to see if that pressure, that bulge, stays elevated. That's it. So simple, but it's packed with information.
And hey, here's a great little pro tip from the research. Despite the name, the hepatojugular reflux, right? You don't actually have to press directly on the liver, which, let's be honest, can be pretty uncomfortable for the patient. It turns out that applying pressure right to the midline of the abdomen works just as well to get a reliable result.
Okay, so we've done the test. Now for the really important part. What does a positive result actually mean? What is that lasting bulge in the neck veins really telling us about what's going on with the heart?
So the official clinical definition is super specific. A positive HJR is when you see that jugular venous pressure, that bulge, stay elevated by more than 3 centimeters for at least 10 seconds. Anything less than that is generally considered normal. Now this part is absolutely key. A positive HJR doesn't just point to a problem on the right side of the heart. Big studies, like the major ESCAPE trial, have shown a direct link between a positive HJR and high pressures all throughout the entire heart and lung system. We're talking the right atrium, the pulmonary arteries, and even pressures backing up from the left side of the heart. At the end of the day, it's a really powerful indicator of widespread fluid overload. And that brings us to our final and honestly most critical section. A positive HJR isn't just a diagnostic clue. It's a powerful sign of what's to come. It can tell us a whole lot about a patient's risk of future problems, which makes it a potentially life-saving piece of information. And the evidence for this is just rock solid. This quote from an analysis of the landmark ESCAPE trial really says it all. It shows that this one simple sign correlates highly with all the other key markers of congestion, from what you find on a physical exam to blood tests like BNP. So this isn't just some old-school trick. It has serious, validated scientific credibility.
And get this, studies have found a specificity of 96% for the HJR in diagnosing heart failure in patients who come in with shortness of breath. I mean, that is an incredibly high level of accuracy for a test you can do in seconds at the bedside.
And this is where the power of the HJR becomes truly sobering. This chart shows the 6-month mortality rate for heart failure patients after they've been discharged from the hospital. Now, for patients whose positive HJR went away with treatment, the rate is significant. But look at the patients who still had a positive HJR when they were discharged. Their mortality rate was more than double. A persistent positive HJR isn't just a sign, it's a huge warning of what's to come.
And the risk assessment gets even sharper. When you combine a positive HJR with another sign of volume overload, like jugular venous distension, the 6-month mortality rate nearly doubles again, jumping from around 17% to almost 34%. These basic, fundamental signs, when you put them together, they paint an undeniable picture of a patient's risk.
And this just brings us right back to where we started, doesn't it? This quote sums it up perfectly. With all of our advanced technology, there has been a reduced emphasis on physical examination skills. The story of the hepatojugular reflux is just this powerful reminder that we cannot let these valuable, truly life-saving skills fade away.
So, we'll end with this question for you to think about. The HJR proves that sometimes the most elegant and powerful tools are the simplest ones. It just makes you wonder, in our constant rush for the next big technological leap, what other simple, profound wisdom are we at risk of leaving behind? Thanks for joining us.